So what we're looking at in terms of the coordination component is that all of us are looking for kids to do well in their motor skills, whether it's the writing, cutting, opening lunch boxes, running, jumping, hopping. The trouble is that those outcome skills are absolutely based on the sensory processing. And the reason I'm harping on this at the moment is because it's the stuff we assume is in place, because we can't see it. You don't see clear evidence when it's not in place. And unfortunately, at this point in time, OT is the only discipline that's really looking at this stuff, because we have to, for the purposes of our curriculum, assume it's in place. So if that's not working well, then it gives you information about the fact that your muscles aren't nice and strong probably, or able to maintain positions, which then means you can't keep your posture in quite the right spot, which then means you can't move well. A quick example would be you and I being reasonably skillful. When you throw, we'll use one isolated arm. Lots of our kids do the duck bill because they haven't worked out how to isolate limbs. It's true with writing and cutting that kids use their arms instead of their fingers. And unfortunately, to isolate that skill, which is what makes us so skillful at it, you have to actually have good strength, which relies on good feedback from the muscles, which of course is sensory processing. So this is the overall snapshot of where everything fits together. But diving in then to some of those skills, we're looking at the sensory integration. And the snapshot about sensory integration is, how is it that you know when you're eating an orange that you're eating an orange? How is it that we know this? It's amazing what your brain does, that not only does it recognise that it's feeling something, but you control your fingers to do just the right thing at the right time, and you smell and you taste, and yet you can process sound and sit upright and breathe all at the same time. It's truly amazing. So what we're finding then is that, in fact, when you're doing any kind of activity, your body releases basically a chemical reaction that then is converted into sensation, which then becomes perception. So if your conversion of that information from sensation to perception isn't good, then your awareness of the world or your reading of the world is completely off. And this is where we see many kids with sensory issues don't fit our world. They see the world so differently, they feel the world differently. So, wow, it's amazing what the body does. But if you take that a step further, what we find is that in fact little people are purely driven by sensation, particularly before the age of 7. The thing that's perhaps most prevalent to notice is that when kids get to about 7, this is where their mental capacity kicks in, so that they're more interested in playing much more complex and imaginative games that are cognitive in nature, not sensory in nature. This is assuming, of course, that all the sensory components are in place. So it kind of makes more sense to be starting school closer to 7, despite the fact that our curriculum doesn't support that. So in terms of all this sensory input I'm talking about, what I should clarify is that there are, of course, the 5 senses that we know about: touch, taste, sight, sound and smell. But the 2 that are hidden are body awareness and movement. Now, we as teachers and parents typically know the body awareness when it's not going well because their kids are in your face, or they're invading other people's space, or they're hugging other people too tightly, or they're pushing too hard. As an adult, the closest we get to poor body awareness is probably having a bit too much to drink, or if you've had a really bad ear infection and there's that nasty fog around you, things don't seem to work quite as well as they should. And also, what you're more likely to see is adults who've had a stroke and have lost control of one side of their body, particularly, or awareness, so they don't allow enough space when they're walking through a doorway, as an example. The movement information, though, is actually equally important, because this is what allows us to maintain an upright sitting position. So you know where your head is in relation to gravity, and yet some students simply don't have that. Not only do they not have the muscle control to maintain it, but they wouldn't know which way was up anyway. Which then means, even at a very simple basic level for a typical student, if your processing of movement isn't good, it means that you don't notice when you're falling quickly enough, so you haven't got time to make a protective response to stop yourself from falling. So you fall off your bike or off the swing or over your own feet before you've had a chance to think, oh, gee, I'm falling, I need to do something about that. So the trouble is that we unfortunately find that when sensory processing works very well, it's a bit like all of the information flowing along a roadway where it works really well. But when things go wrong in the sensory system, you get this nasty traffic jam effect where all the information is coming in, but it's somehow misguided. Which then means the first thing that happens is frustration. And often it's this frustration that triggers us to seek out assistance. And unfortunately within the DEC system, our only option really is to do that through a psych assessment, which often tells us what we probably suspect already, that we're good at this but not good at that. And the frustration is due to the deficit between those two, which makes perfect sense. The trouble is it doesn't actually change it. This is where OT tends to get involved to reduce the traffic jam, to reduce the frustration and narrow the gap between often very good intellectual capacity or verbal performance versus poor ability to demonstrate that. What we typically look at is the fact that the way we all process sensory information is, you and I will assume are being perfectly in the middle here, but we have some kids that are overreactive, so they have just a little bit of sensation and then they react negatively to it, whether it's smell, someone taps them gently from behind, finger painting is a horrible experience. Through to the other end of the spectrum, who are the kids that are underreactive. So it's a bit like wearing gloves when you're trying desperately to tie your shoelaces. It's really hard because you're not registering the information that you need, which then tends to mean that you look a lot more like this little person, very sleepy and lethargic, which is how most of us look. Alright, so this is how we used to talk about this sensory processing, but it's actually not so much relevant now. Instead, we'll look at 4 different groups, which is true for all of us, even as adults. There are the very active crowd, which are the sensory seeking and sensory avoiding groups, who generally either say, give me information, or yuck, stay away, versus then the more passive crowd, which are the sensory sensitive, who don't like stuff but will do it anyway, versus the low registration, the slow and sleepy crowd. And the fascinating thing about this is that in any kind of group, you're going to get a combination of them. And not that I'm suggesting at school that you cover your kids in shaving cream, but this is a camp situation where we did just that, and what we found was very quickly you work out the sensory seekers who were saying, yay, give it to me, versus the sensory avoiders. This little girl in the pink bathers with the yellow flowers on it at the time of taking the photograph was trying to get the shaving cream off her dogs. Oh, I've got shaving cream on me. And of course what happens is the sleepy lethargic kids are the ones that sort of hang back and aren't quite really sure. They'd much prefer to have a bit of a look. And the sensory seekers go, oh, there's a good target. And usually the targets that are good are really the sensory avoiders, who are the ones that go, no, get off, go away. So you have this fantastic behavioural stuff happening. So I guess what I'm really wanting to suggest to you is the sensory processing is really important, not only because of what it does for your body, but because it really influences your readiness to learn. So the hypo crowd are often the ones who are very sensitive to sensory input, either seeking it or avoiding it. So they're physiologically set up not to pay attention for whatever reason it is, as opposed to the low registration crowd who are set up to not really bother. Why would I do that? So unfortunately your sensory processing is absolutely fundamental in looking at your attention, and particularly when you see the increased rates of kids being diagnosed with attention deficit disorders. I would argue, unfortunately, that there are many kids who actually have sensory issues, not purely attention deficit disorders. So typically what we would do here is try a sensory non-drug regime before we would then consider the other options, along with the other things like fish oil and all the other more natural options that are available too.